Hello, my friends. Today is July 1, and I wanted to talk about the, I would say, Medicare that's being affected for dentistry. And I'm currently in the state of California, and California has extended one more year to not change anything with our state Medicaid plan. However, in a lot of states, the Medicaid program will be cut, and it's going to affect a lot of patients and a lot of dental practices, especially dental practices that are Medicaid based. Now, if you're heavily Medicaid and now the government has cut down and reduced your Medicaid, your finances and your profitability is going to be tremendously affected. Now, your reimbursement for the plans and everything that was done, like all the treatment that was done before July 1st, before today, will still be honored. But starting from today, moving forward, the Medicaid plans will be cut and changed, and every state will be different. And if you're not on top of this information, what's going to happen is that patients are going to come in, and patients, a lot of them won't even know. They won't even know that these plans have changed. So it's going to affect a lot of adult patients, and more importantly, and in my heart of hearts, this is sad, it's going to affect a lot of children. A lot of children who won't be able to receive dental care. A lot of young ones will then be affected, and there's going to be a lot of emergencies. There's going to be a lot of children missing school. There's going to be a lot of kids probably ending up at the pediatrician's office because of dental pain. And I don't know what a lot of my pediatric colleagues are doing, or my colleagues that are dentists that treat children are doing, and how every state is different. But I hope that you look into your state and see what the changes are. And luckily for us in California, it won't go into effect, and things are stable for another year. But if you are in another state, please look that up and see what is going on. And this kind of highlights a lot of the reasons why you should be involved with organized dentistry. And I'm very happy to say, I'm very proud of my colleagues in the state of California who went and lobbied and made this change go away for a year. And so, again, I'm thankful for all of our colleagues that are involved in organized dentistry and fighting this and helping to treat patients, because there's going to be a large volume of people that are affected, and a large part of our dental colleagues who are all Medicaid based that's going to see a big difference. And, I was talking to my colleague. Hi, Dr. Layla. Hi, Shah. Dr. Haisha, how are you? Dr. Haisha is a pediatric dentist, and she recently retired. But for some reason, I feel like you're busier now than ever. And Dr. Haisha does amazing work. I just want to say that a lot of hospital residencies and dental schools take Medicaid. And when I was a pediatric resident at the Chicago Children's Hospital, we saw a ton of volume. It was like all of our GA cases were Medicaid patients. And so I'm not really sure how this is going to affect hospital and residencies, because again, I don't know all the details, but I hope that if you are, practicing in this space of Medicaid, that you guys are on it, and I'm sure you are. And I hope that we can be there for the children, and that a lot of children won't be suffering from this. Hi, Rashmi. How are you? Hi, Dr. Ken and Dr. Rashmi. Hello, Inner Fifth. All right. Comment below. Let me know what you guys are up to, what you're doing.